Today I'll be presenting a case report on the topic of parasitic infection. Patient is presented with primary diagnosis of cholecystitis, choledocholithiasis, mechanical jaundice, acute abdomen, non-hemorrhagic dehydration, and parasitic infection. The reason being, patient complains of pain in the right hypochondrium region with vomiting and diarrhea as well as fever of 37.9 degrees Celsius as additional complaints. Upon inspection, patient has yellowish skin and eye sclera as well as dry mucous membranes, which supports the idea of non-hemorrhagic dehydration. Patient has tachypnoea with a change in the lower border of the right lung upwards. During GIT inspection, there is enlargement of the liver size. The plan on lab and instrumental diagnosis, expected changes in complete blood count is increase in hematocrit and white blood cell due to dehydration. Hemostatic system, there is an increase in prothrombin time as well as INR, where bleeding is more prone. Electrolyte balance are decreased in sodium and chloride, where there is no change in potassium since potassium is in intracellular. Liver function tests are increase of ALT, AST as well as total bilirubin. In urinalysis, we expect there is no change in creatinine levels. However, there will be an increase in conjugated bilirubin and urobilinogen. The expected changes in instrumental diagnosis are large parasitic cysts in the liver during ultrasound, as well as the obstruction of common bile duct. In the plain chest X-ray for the liver and abdomen, there is a shadow contrast over the right hypochondrium region showing the cyst capsule. Results are corresponding to the expected changes. As for the final diagnosis, if given hydatid cyst of the liver with obstruction of the common bile duct, and for the plan of treatment, medication-wise, given mebendazole, which is an antihelmintic drug, 400 milligrams tablet twice per day for 4 weeks. We also administer ibuprofen for the pain of in the right hypochondrium region, 800 milligrams per 4 hours for pain, and infusion therapy of normal saline for dehydration until vital signs are stabilized, where patient has no tachypnoea, no fast breathing, and there is a return of moisture of mucous membrane. For surgical, preoperative, I'm going to do a surgery on cholecystomy and partial hepatectomy under general anesthetic. So the indication for surgery is life-saving. Risk of bleeding and thromboembolism is moderate. Overall risk of surgery is moderate. There are no contraindications to surgery. Preoperative checklist, social data is confirmed, vital signs are checked and are stable. Re-examination is done without any new findings. The area of surgery is shaved and clean. Intraoperative, aseptic technique was done. The vital signs during surgery are stable. Surgery is done with anti-embolic stockings to prevent thrombosis formation. Surgery is successful and it took 2 hours. Post-operative care, day 1, vital signs are stable. Patient is placed in a supine position without pillow. Every 6 hours, patient is given back rubs, position is changed. Patient is re-examined in 3 hours by attending doctor. Dressings are changed 3 times per day. Urine output of patient returns to normal after infusion therapy. Before was decreased, now it is increased back to normal. Diet of patient is placed on non-POS. Medication regime, heparin given every 4 hours. Ibuprofen is every 4 hours, and with the antihelmintic of mebendazole is continued. Day 2, vitals and are stable. Patient is now given with pillow on supine position. Dressing are changed twice per day. Foley catheter is removed. Diet is now switched to clear liquid for the first half of the day and continue with full liquid on the second half of the day. Medication regime is as of day 1. For day 3 post-operative care, diet is switched to regular diet and lab tests and hemostatic system, complete blood count, and urinalysis is ordered. Results of blood analysis, hemostatic system, as well as urinalysis are in the normal range without any pathological findings. The IV line is removed, nasogastric tube is removed since diet is returned to regular diet. There are no surgical complications throughout the post-operative day of 1, 2, and 3. And after a week of post-operative care, patient is re-examined again and a lab test is ordered. And once there are no complication and no pathological findings as well as complaints from patient may be discharged from the hospital, and patient can continue the medication regime of mebendazole antihelmintic and complete the course of over 4 weeks. That is all. Thank you.